Hello, everybody. It's Dr. Lauren Powell, board certified medicine physician, the culinary doctor, and the co-host of UrbanMD TV, the first and only national TV show to talk about health and wellness through a multicultural lens. Today, we're going to be talking about something a little more serious, okay? So we're talking about Black maternal health. Now, what is maternal health? Maternal health is the health of a person while they're pregnant and postpartum. So it's not just while they're pregnant that we care about. We care about that year or so after they've already had a baby. And when we talk about maternal health, it's not just physical health. It's mental health and it's social health, because we know those things matter. And unfortunately, hundreds of women die every year from pregnancy-related complications, either during pregnancy, during delivery, or thereafter. And that's a problem because according to the CDC, this is not my words, this is according to the CDC, 80% of pregnancy-related deaths are preventable. Again, 80% of these pregnancy-related deaths are preventable. And so now the next question is, why Black Maternal Health Week? Why is there a whole week highlighting that? And that's because Black women are 3 times more likely to die due to pregnancy-related complications than their white counterparts. 3 times more likely. So it's really a Black maternal health crisis. Giving it a week is not doing it true justice, but we hope today that we will have some powerful discussions and that we move the needle forward. So first, you guys, and again, this is a jam-packed hour, but I'm going to be respectful of your time. Just to give you a little overview, I'm going to bring Dr. Kameelah Phillips, who's an OB-GYN. Then I'm going to bring Jade Kearney Dubé, who's an Afro tech, has created some amazing things around maternal health. And then I'm gonna wrap it up and I'm gonna do a little cooking demo for you of like an ideal meal for a pregnant mom, for you to support her and her health. All right, so first I want to bring to the stage Dr. Kameelah Phillips. Hello, welcome.
Hello, welcome. So good to see you.
You too. Now, Dr. Kameelah Phillips is an OB-GYN, which means she's taking care of moms, or taking care of women who desire pregnancy, taking care of women while they're pregnant, and she's delivering those babies, and she's taking care of them postpartum. She herself is a mother with a whole bunch of kids. It's 3, but that's like a whole bunch. I have 1, and so anything more than 1 is a whole bunch of kids. So she got a whole bunch of kids, and she's a Black woman. So she is the ideal person to have this conversation with. Anything else you want me to mention about you, Dr. Phillips, before we kind of really get into it?
No, I want to spend a lot of time on this conversation so people can look me up later.
Okay, thank you. She's so gracious. So Dr. Phillips, I know, you're passionate about Black health in general, not just this week, but a lot of your work has been dedicated to that. And when we talk about the crisis of Black maternal health, what do you feel are some, and I know this is a really hard question, but what do you feel are some of the underlying reasons? Like, what is the underlying cause?
I
know, right?
My answer to this has really been the same for several years. And it's just now that we're having like research and papers validated, but the answer is really racism. This country was founded on chattel slavery, and the effects of that just continue to permeate our systems. If people have not looked up this phrase, social determinants of health, it's basically where you live, how you eat, where you worship, if you have parks, and like how you exercise, all of those things are influenced by basically your life and your community. Black people have some of the poorest social determinants of health: access to fresh food, parks, health knowledge and access, including hospitals. We're 5% of doctors in the country. All of those things permeate Black maternal outcomes and experiences. Not to mention the fact that the medical system, we know, has huge racial bias. So, the crux of it is racism. And in acknowledging that and fixing those systems, I think that's what's going to help us get over this hump.
That's good. I want to note also, as we talk about the social determinants of health, um, being of a higher economic status, being having a higher level of education, does not preclude you as a Black woman from having this risk, right? It's regardless. I mean, we've heard about famous people and people in the media who've been dismissed when they express concerns about their pregnancy or about their delivery. So I want people to know that this is affecting just such a large group of people. Anything to add to that?
Yeah. Yeah, I was just saying there's actually studies now, and that's what I'm saying why this is so um, profound is because now we actually have studies that document white women, Black women, higher socioeconomic status, high social status still have negative outcomes as it relates to preterm labor, as it relates to preeclampsia, as it relates to death, as NICU experiences. This stuff is now being documented. And while there are things that I absolutely think that we can do to make it better as a culture, as individuals, etc., this is also very largely a problem of our systems and unlearning bias,
Mhm.
racism that's embedded in our system. But yeah, we have research that tells us that even if you're wealthy and live in the Hollywood Hills, you are not immune to this problem.
7:08 p.m.
Yeah, so I think that's a huge thing. I want to talk about. So I think it's very clear there's a major problem, right? I think nobody can argue with that. And we know it's really multifactorial, but what can we do? And I want you to answer that in two
Yeah.
ways. What can we do as a culture, as a patient, as someone who desires pregnancy or supporting someone in their pregnancies? And then secondly, as a medical community, I'm a physician, you're a physician, I don't deliver moms. I definitely take care of them as their primary care doctor, maybe while they're pregnant, and I definitely am seeing them postpartum. I'm seeing them while they're maybe thinking in the preconception phase. So I want you to give me that in two ways. What can we, the people, as a culture, do, and then as a medical community?
Okay. And girl, you know I'm perimenopausal, so you might have to repeat that question again because the brain fog is real. But what I'm going to say is, what
We
can
should have
we do?
another conversation about
As a culture, what can we do? I can't express how important it is for us to vote. We have to vote because we are voting for people who control the social determinants of our health. We're voting for people who
that.
decide if I live in Harlem, if Harlem has 12 times the amount of air pollution because we have all the bus terminals versus Soho, whose air is clean and beautiful, right? We have to vote because restrictions, who do they affect? They affect us. This is an overarching thing. So we have to vote to improve the community around us and the laws that affect us. As a people, which is why I love your efforts and this program, is we have to elevate our medical knowledge and our medical literacy. I'm going to tell you a quick story, and I tell it not to like shame the patient, but because it's just so profound. So here it is. Talking to a patient, and I'm like, we got to reduce carbs. This isn't it. You're pre-diabetic. We got to work on this thing. And oh, what are carbs? Okay, you know what? Just start with not eating anything white, right? So I assume that patient comes back, the values are still not improving. I was like, I thought we talked about, rice, white bread, potatoes. She's like, I was like, what'd you have for lunch today? She's like, fried rice we have a place down the street called Charlie's. Fried rice from Charlie's. I'm like, but we talked about that, not eating out in the street or processed foods or um, carbs. And she's like, but doc, the rice was brown. And it blew my
Mhm.
mind because she's right. I didn't, you know, it really hit home to me that we have huge gaps in our medical understanding and literacy, especially when it comes to nutrition. So improving our health literacy and nutrition education is really huge because a lot of the things that I deal with, like you probably as family medicine, is lifestyle stuff, right? So it's eating, the quality of our food, access to our food, exercise. Those are like really big things. If we could fix that and come into pregnancy, lower weight, not so predisposed to hypertension, diabetes, which are often the see, I think as a culture that could really elevate us. And then the final thing is just understanding that the health of the mother, absolutely. I have two patients, right? The mother and the baby. The health of the mother, we have evidence that the health of the mother during her pregnancy actually affects the child long term and their risk of heart disease and diabetes and such, that we really need to rethink the concept of pregnancy as an active health state. Even we have research that shows the health of the father impacts pregnancy. So that kind of health literacy and understanding, along with voting, I think will take us a good way.
That's good. That's so good. And I think the emphasis cannot be made enough on the status of your health going into pregnancy. And that is why it's so important that you're just seeing a doctor regularly. I don't care if you feel amazing. It doesn't matter if you feel great, because a lot of times you don't feel these things. You don't feel high blood pressure. You don't necessarily feel insulin resistance. These are things that you don't feel. And so what happens is, and what Dr. Phillips was explaining is, we go into pregnancy with our health not optimized. Pregnancy itself is a major stressor on the body. I know it's a beautiful, magical, wonderful, natural thing, but let me tell you something. That blood volume doubles. That heart has to work.
Yes.
It is a stress on the body. And so we just have to make sure we're optimizing our health before. And it's something why I talk to my patients. It doesn't matter how old they are. They could be 16, 17 years old. And I just say to them, what do you think about children? What do you think about it? And all of them say, yeah, I think I want to have a family one day. Okay. Well, just in thinking about it, these are some of the things that we should do just to make sure you're as healthy as possible now. Because you're basically growing and taking care of your eggs now, right? The eggs that will become your future children. So I think that's important.
Right.
And I wanted to make sure, and I'm so glad you mentioned, because I saw this on the Association of Black Cardiologists Instagram yesterday, and I want to quote the thing of this for this exact reason. It was a 2021 study showing that the health of the father before conception can affect the health of the mother during pregnancy. To me, that's like
absolutely. Yep. Isn't that crazy?
That's
yeah.
So it's not just about
it's wild.
You. It's about the person that you just, are planning to have children with. How is he taking care of his body before you all even get together?
Get it together.
So which means everyone's health has to be optimized, not just potential mother, but father has to be optimized too.
That's why this is so crazy and so exciting. And I know we talk about these really negative statistics, but I'm telling you, I feel like, and we didn't get to the question about the medical society yet, but that's why I tell my patients, we have so much that we can control that it's actually kind of fascinating to now have the data to support what you and I have been telling patients all along, right? Everyone having a baby is truly a village. So everyone has to optimize themselves so that we can elevate the health of our mothers.
Great. Okay, Dr. Phillips, wrap it up. Last question about what do you feel we as a medical community can do? Because anytime I see stuff like this, I'm like, what can I do better? Because I'm a part of the medical community too. And so I just want to know what we do.
Yeah, I feel that way too, because, it's weird. We're Black, we're women, but we're also doctors and part of that system, right? That's oppressing people. Starts in medical school. Well, it actually starts before medical school. We have to unlearn our biases and we have to unlearn racism. All of us, even Black people. We have to unlearn these isms that prevent us from listening and hearing our patients when they tell us something is wrong. Like, period, point. It needs to permeate through the medical education of all the systems that are founded in inequality and racism, and help doctors really come from a place of privilege to help elevate their lives and their help, as opposed to like this sort of savior God complex that I think a lot of us have. I think we need to be very humble in our interactions with patients, because each patient can teach you something. Like the patient with the rice example, she taught me that I wasn't teaching nutrition right. I needed to revise how I taught nutrition. So I think relearning our systems in terms of how we integrate race and racism into our education, coming from a place of humility where we know that each step, and really improving access overall, which is just an economic thing, right? Those are the three things that I would say for the medical community.
Perfect. Okay, Dr. Kameelah, you're amazing. You know, I think you're amazing. I just love how you explain things. I love your passion, and I'm feeling you. Like I feel you talk in your videos, and like I just feel you, and I know that this is coming from such a place of just deep desire to serve well and for our people to be served well. And so I respect that so much, and it inspires me to want to be better too. I would like if you could wrap up and
Thank you. I love us.
let the folks know where they can follow you, where they can learn more about you. If they want you to be their doctor, what can we do?
Yes, yes. Thank you so much. So I am on Instagram at Dr. Kameelah Says. I'm in New York City. So come see me if you want to become a patient or need a consult. I see patients from all over the world, but I want the best for you and your health. And I would tell my Black mothers, I got your back. We got you. Make them babies. Make them babies. Listen to what Dr. Lauren has to say. Elevate your health, and let's grow our community.
Let's do it. I love it. Thank you so much, Dr. Phillips.
Take care.
That was good, right? I told y'all she was good. She's so good. So I think we can glean a lot of great information from that. I think it's very clear that racism is kind of like this underlying ideology of these healthcare disparities that we're seeing. I think I'm always a person that's like, give me something that I can do. That's me. Like, what can I do better? What can I personally do? And I think optimizing your health, and you guys are going to hear me say that so much, is so important. It's so important because good health, you don't value it as much until you don't have it. And don't wait for that. So if you're listening, because you're contributing to this situation as well, and potential mommies, future mommies, this is also a message for you. Okay, so let's segue into our next guest, and this is Jade Kearney Dubé. I want to make sure I said her name right. Now, she has come up with some amazing technology to help moms, and really it came from her own experience postpartum. So let's bring her to the stage.
Hi, everybody. Thank you for having me.
Hey, Jade. Thanks so much for being here. Yes, I hear you.
Okay, great.
So, Jade, go ahead and tell them a little bit about you and kind of She Matters and kind of how that was birthed.
Okay, well, I'm a mom of four, but that wasn't, of course, always the case. I'm from Newark, New Jersey. I was a teacher, and like most Black women, I knew the statistics going in when I got pregnant with my daughter. But like many, I thought that the heavy lifting, the hard work, and the danger would be during pregnancy and during my birth. I did not realize that the heavy lifting for me and the danger really would start postpartum. I don't think most folks are aware because of media that most women who died during their postpartum period, meaning after you have a baby. I had preeclampsia, I hemorrhaged during delivery, but my biggest challenge was mental illness. I had postpartum anxiety, OCD, in the form of intrusive thoughts. So I would think things like, oh my God, I don't want to walk near the street. What if I let go of the stroller and a car hits my baby? Or I don't want to walk near the window. What if I throw my baby out the window? And it's nothing that I wanted to do, but it was just now looking back, understanding what happens with PMADs, right? Postpartum mental illness and disorders, was that I had a hormonal imbalance. And I think a lot of Black women experience this and don't have the space to talk about it for many reasons. So after I went through this, or when I was going through this, I would speak to all kind of people trying to figure out what was really going on with me. And I spoke to my mom, who's the mother of 8, and I said, I think I'm having some type of postpartum depression because I didn't have the words to communicate what I was experiencing when I was experiencing it. And my mom was like, we're Black women. We don't have time for postpartum. You have to go back to work. So immediately I felt like I was failing cultural norms of suffering in silence. It was an awkward thing that happened to me. And then I reached out to my healthcare provider, who was an amazing OB-GYN, but he was not a therapist or a psychiatrist, and immediately said, I'm going to send you Zoloft and I'll follow up with you. And culturally, like, Black folks have trouble with taking SSRIs or antidepressants. It's like not something that we talk about openly because of the stigma of mental illness. And so I felt neglected by healthcare, but also like shamed and shunned by my community. And I do what I always do when I have a problem or have an issue. I called my best friend, who is also the co-founder and COO of She Matters, Marguerite Pierce. And I said, like, this has to change. Black women need a place that they can go to, one, to have the resources, the education and understanding of what happens and how during postpartum, and the best way to protect ourselves from comorbidities and death, right? But also the heavy lifting shouldn't have to be on the mom's end only, right? I feel like a lot of the work that's done to ensure that we live and that we thrive and that our babies thrive, it's put on us. But healthcare practitioners who are not culturally competent need to get there so they can also meet us where we are. So what we do is a culturally competent certification in Black maternal health, where we teach healthcare providers how to better meet the needs of Black moms.
I love that. I love that.
Thank you.
And so, kind of, what have you seen through that training? What have you seen? What have you learned?
One thing that is always surprising to me is how few healthcare providers actually know the statistics around Black maternal morbidity and the epidemic that we're in. I think you learn very quick that some of the things happening are the things that happen in a systemically racist society. People don't have the information and they don't know the origin stories. Chattel slavery is how we got here, and all of those social determinants that that you were conversing about earlier add to what is happening for Black maternal health. So if folks don't know the history, then they repeat, right? Like, you have to understand where things have gone so you can understand where you're going or where you are. And I do not know, what I've seen is that many healthcare providers don't know. They don't know the details of how we got here. They understand that the system is somewhat broken, and they understand that Black women have higher risk, but they don't know why. And so what we do is we help them understand why, right? To bridge the gap in communication, but also to ensure safety for not only the Black mom, but for the physician.
Yeah, that's good. And I think, obviously this is not something that's talked about in our medical school training. I think no one is immune to biases, you know what I mean? Like, no, and nobody has a bias intentionally. And I think for those
Right.
who went into medicine, you desire to do good. You know what I mean? You desire to do good. And so being culturally competent is what is required to do good medicine. And you're right. And then I feel like there's so much put on the mom postpartum in terms of managing her own health and then managing the health of this little baby, that it really does require a village. It really does require a village. I want you to talk a little bit about the app you've created.
So we have a symptom tracker, which will be released in May. And that symptom tracker is for preeclampsia, eclampsia, and HELLP syndrome. And what it basically does is it tells and asks a mom 5 core questions around blood pressure. And it sends her to the hospital if she is in any type of crisis. We realized quickly that preeclampsia, eclampsia, and HELLP syndrome are some of the biggest factors for maternal morbidity and mortality, right? And I was pregnant with twins, and I was on the 4th floor in Harlem in a brownstone. And I was like, I'm not going to go downstairs to check my symptoms. And I couldn't quickly find, because I had preeclampsia prior, I couldn't find anything quickly to understand if, like, my headache, like how how severe my headache was, and if I had upper right quadrant pain, and there was nothing. And I was like, well, we need to create this, right? So that's our symptom tracker. But as far as resources for moms, we have a whole community where Black mothers can get free therapy. They can get connected with doulas in their community. They can come to group sessions for therapy, because the other thing about postpartum is we don't the village is for the baby oftentimes, and it's not for the mom.
Yeah.
So Black moms, or all moms, really end up feeling like no one is paying attention to me, and I can't even pay attention to me. So our community is there to offer resources so you don't have to Google all through the night while you're supposed to be sleeping.
That's good. That's so good. And I'm glad, we know that having these extra support people during your labor and delivery are important. But sometimes they're cost prohibitive, right? Like it's
Yeah.
expensive, and sometimes insurance, most of the time I found that insurance doesn't cover those things. Talk to me a little bit about, and I'm not sure if you had kind of a multidisciplinary team, but talk to me about how you feel, how important it is to have that support, in addition to a medical provider, having a doula, having a midwife, having someone that's just kind of also advocating for the mom, because I think that's a big part that it's hard for us to do when we're like literally trying to have a baby. And so talk to me a little bit about how important that is.
I think it's one of the most important things. I had a doula, an amazing doula, and she not only helped me understand that, yes, we have this birthing plan. She helped me gauge the expectations around it. Like, if something happens, everything changes, and the plan is not what it's going to be, but we're going to get through this together. But it was also informative for my partner, right? Like, having those meetings beforehand and going into the room with someone who was culturally competent, because what happens during your birthing process is that there are doctors coming in, and they want you to be healthy, and they want the baby to be healthy, and they're going to tell you what should happen, right? And your doula midwife will say, what, does this have to happen? Like, there is a choice. Let's exercise our choices, which is kind of difficult when you're in a crisis, right? But also, people don't talk about this often enough. If you are in a space that is systemically racist, and there is a problem, and your partner is Black, and your partner is male, and he raises his voice, and he's deemed as aggressive, security may remove your partner. So I think having a doula, having a midwife present to advocate for you in that room, but also to advocate for your partner, because of the type of system we're in, is important. It's important for the birthing process, and it's important for the postpartum process as well, because like how you start is how you finish, right?
Yeah, that's super important. And with the dad, that's a good piece. That's a good thing too. We don't really talk enough about, and I think that's why it's also important that the dad is along for the journey when you're selecting your OB-GYN and the person that's going to deliver your baby, because you want them to have a good relationship as well. And I heard Dr. Kameelah actually say this. Somebody asked her about, if you feel like you're not being heard by your doctor, what should you do? And I think you need to feel comfortable with your provider. You and your spouse both need to feel comfortable with your provider. So I never want people to hesitate about getting another opinion, or seeking help from someone that you do feel comfortable with. And I tell my patients that I may not be the best for you. Please, you're not committed to anyone. Okay. So I do want to let people know that you're not stuck. So last question I want to ask you, Jade. If
Yes.
I had a magic wand and I could give you $1 million, what would you do with it in this Black maternal health space? Like, where do you see a gap where if we had more resources, we could make some substantial changes? So maybe more than $1 million.
Yeah. It's like, in this economy, right? If I had the money that we needed, it would be around mental health. Mental health providers, there aren't enough. They're all stressed themselves because there are so many clients, but they would be culturally competent psychiatrists and psychologists who focus on PMADs, because there aren't enough people in that space. And what happens is women get on a call and they're on hold, or they get 2 weeks prior between having psychosis and they can't reach anyone. And then there's no help. And it's like, what are we supposed to do in this broken system where women who had traumatic birthing experiences, who have had C-sections, who almost died during birthing, and now they need somebody to talk to because they're having mental health crisis and they cannot get on the phone with anybody. It is, I think, one of the worst things. And most of the time when they get on the phone with somebody, they're not culturally competent, right? So I would give everyone the She Matters cultural competency training and get everyone certified, so that when a Black mother runs into a hospital, gets on the phone with a therapist or psychiatrist, or finds an OB-GYN, regardless of race, color, creed, anything, they are certified to take care of you, because at the base level, they're culturally competent. And that can change anything, because if you can communicate with your provider and your provider feels safe communicating with you, then that adds to positive outcomes for both of you.
Yeah, the maternal health and the lack of resources is major. I mean, it's major for non-pregnant patients. And the thing about postpartum depression, postpartum anxiety, is we don't plan to have it, right? It's not like we plan to have a baby and so we booked an appointment with a provider in advance. You don't plan, you don't know how you're going to react after pregnancy. You don't know how that stress is going to impact your health. And it can be different even from pregnancy to pregnancy. And so it's difficult because you're in a situation where mothers need help like right away. And being on a waiting list for 2 or 3 months obviously is not doing a service to the mother. One thing I want to note is I had actually a colleague of mine, and her insurance covered a social worker. And so she met with her while she was pregnant just to kind of establish a rapport. And I know that's not a psychologist or a psychiatrist, but I think just having that extra support person to just have more resources and to be checking on you postpartum is important. So I also just want to add and encourage y'all to just check into your insurance and see what they cover, because you might be surprised. And also, there's no harm in establishing with a mental care provider when you feel well. That's actually the best time to do it. There's no problem establishing when you feel well, letting that person know I'm about to go through this major life change, and I just want to have someone that I'm already established with and I have a relationship with that I can connect with. So I think that's important, and I'm so glad that you mentioned the mental health, because when we talk about maternal health, it's not just the physical health. It's not just blood pressure and blood sugar. Mental health is huge. Jade, wrap it up for us. Tell us, where we can find you, where we can learn about this training. How can we know if a doctor has had this training and if they're certified? Tell us about the app. I know you said it's going to be released soon, but tell us all about it.
Okay, you can find us at shematters.io on Instagram. She Matters on Facebook. You can find me at Jade Kearney Official. You can go on to www.shematters.health and sign up for our training. You'll know if a healthcare provider is trained because they'll have a certificate that says culturally competent from She Matters. If you have any other questions or thoughts about what we're doing, you can always reach out to us on our website or through social media.
Awesome. And when does the app drop again? Just remind folks.
The app will be dropping May 2024, so next month. And that is a symptom tracker for preeclampsia, eclampsia, and HELP. But you can sign up on She Matters right now and become a part of our community and get all of those resources that I talked about. You can sign up through our Instagram, or you can go online and sign up.
That's great. So you don't have to wait until you're diagnosed with these conditions. If you're pregnant,
No.
you should have the app. And, I would love to support you in any way that I can in making sure every OB-GYN in America knows about this resource that they can provide to their patients, because I think they would love to have it too. They want this objective data information too. So I know it's going to serve us to be better. And it's also obviously going to do the patient a service as well. So thank you for that. Thank you for putting your efforts toward that. Thank you for using your experience, which was, not the best, and using it for good. I really appreciate that.
Thank you for having me. Thank you so much.
Take care. All right, y'all. We doing okay? That was good, right? I love that. So listen, let's get set up for a little cooking demo. I'm going to move this camera around a bit so we can make sure I'm in good position. And I want y'all to write down some of these things. See me okay? There we go. So when it comes to, you guys know I'm the culinary doctor. This is Healthy Eats and Treats, Maternal Health Edition. When it comes to our nutrition in pregnancy, really we want to start this stuff before pregnancy, right? And we want to just establish as amazing habits as we can so that we continue them through pregnancy and postpartum. Some people have different intolerances in food. Some foods are difficult for patients to tolerate. But I just wanted to show this example of a meal because I was thinking, dang, what can I make for the people? But this was a salad I actually made for a colleague of mine 2 days ago. And she loved it. It's so simple and it's so basic. When I talk about food and maternal health, I'm really thinking about what foods support our cardiometabolic health, meaning foods that support blood pressure, inflammation, obesity, sugar intolerance. I'm thinking about that, and I'm thinking about nutritionally dense. I'm thinking about what meals can I get to a mom or a mom-to-be that have the most bang for their buck, meaning the most nutrition for the fewest amount of calories. So that's what we talk about when we talk about a nutritionally dense meal, because we just get the biggest bang for our buck, and then we also are thinking about cardiometabolic syndrome and how do we support that. So I'm going to make for you all, and I kind of prepped some stuff because I didn't know how much time we were going to have. It's called a Napa cabbage salad, and I'm making it with some blackened shrimp. So let's just go over the ingredients. I prepped some stuff so that it would be out here for us. So I washed and chopped some Napa cabbage and cleaned it really good, chopped it. A great way to store your greens, and it can be romaine lettuce, it can be kale, is while it's wet and damp, you put a piece of paper towel around it, and you can either put it in a container or you can put it in a gallon Ziploc bag. And that's going to keep your vegetables really, really fresh, really, really crunchy. Okay, so I've got the cabbage. I've got the shrimp that I blackened on my cast iron skillet. I have some pickled red onions. Pickled red onions, they're great for digestion. That vinegar is super important because it just really helps maintain our blood glucose level. So I love pickled vegetables. About the shrimp, I picked shrimp as our protein because, again, it's like a nutrient dense protein. It is an amazing source of protein for like very few calories, right? So I think 1 ounce of shrimp has about 7 grams of protein. That's pretty good. That's pretty good. Okay, so we've got that. I've got a lemon and some olive oil. I'm going to use that to make our dressing. I've got some cucumbers. This is how simple this dressing is going to be. All you need is salt, pepper, and if you like a little spice, some crushed red pepper. Easy breezy. Easy breezy. Okay? So let's go ahead and build the salad. And you guys wouldn't believe it. So when I made the salad for my friend, I asked her, and when I made her salad, I also put salmon on it. I asked her, what was your favorite part of the salad? Right? I made this amazing salad. It had shrimp. It had the veggies. It had salmon. And you know what she says the favorite part of her salad was? The dressing. She said the dressing was her favorite part. And I said, it's only lemon juice, olive oil, and salt and pepper. And she's like, it just tastes so good. And it's the freshness. Once you start making your salad dressing, it's like you can't go back to the jarred stuff. We also want to be able to watch our salt content while we're pregnant. And so making our own dressing is a way to do that. Cooking with salt is fine, you guys. Cooking with salt is fine. A lot of times we don't get excess salt from cooking with salt. We get excess salt from the stuff that comes in a jar, a bag, a box, sauces, eating out, those kind of things. So don't be afraid to use a little salt on your food. All right, so I've got these beautiful pickled onions. I got these from Sprouts. I like them because they were very, just very sour. I prefer like the more sour pickled vegetables rather than the sweet. And you can pickle them yourself, to be honest. Super easy to do. So I've got my blackened shrimp. I'm just going to place this ever so nicely. I want to make sure it's nice and cute for y'all. You're going to see how easy this is to do. And it's not going to do justice to see it, y'all. I really want you to make it If you make it, be sure to tag me, Dr. Lauren Powell. Be sure to tag UrbanMD and let us know you made it. Let me know. Don't make it and not tell me. Okay, so I'm just going to take a half a lemon and I'm just going to squeeze that juice out of there. I made sure to roll my lemon so it was nice and soft so the juices are coming out super, super well. Yes, and I love it when some of the flesh of the lemon falls out. That's great. Okay, so we've got some fresh lemon. I'm going to take my extra virgin olive oil, which is full of our healthy fats, and I'm going to do a little drizzle there. Then I'm going to take, for the dressing, I like to use coarse black pepper and coarse sea salt because I just love the texture. I'm a big texture person when it comes to food. So you see I'm just going to do a little bit of salt here, do a little bit of black pepper here. A little bit of crushed red pepper. Let me tell you something. This little extra spice from the crushed red pepper, it's everything. It's everything. So this is a cabbage salad. And I know you're thinking, cabbage for salad? Napa cabbage, not traditional cabbage that we cook on the stove pot. Napa cabbage. It's perfectly fine to eat raw. Make sure you wash it really, really good. If you can get organic, that would be great too. But here's our salad. Let me try to bring it closer for you guys. There we go. What y'all think? What do you think? Are you gonna make it? This is something you can make for your pregnant partner. This is something you can make right now if you're not pregnant. It says we prepare our bodies and optimize our health. Hope this was so good for you guys. Let me make sure I have all my reminders that I'm gonna do. We just did a Black Maternal Health Summit in less than 60 minutes. How efficient are we? How efficient are we? I want to remind you guys that on Mondays at 6 p.m. Eastern Standard Time on Fox Soul, UrbanMD airs. Listen, loving all the comments. I'm so thankful for you guys' support. We have so much amazing content this season. So I would love for you to tune in. I'd love for you to share with someone because we all know someone who needs to or could use the assistance with improving their health. And remember, it's not just optimizing the future mother's health, but men, you matter too. You matter too. So again, I'm Dr. Lauren Powell, co-host of UrbanMD TV, and this was our Black Maternal Health Summit in 60. I'll see you guys soon. Take care.
This is UrbanMD TV.